Good evening and welcome to today's fellowship exam COVID-19 webinar. I'm Julian Archer. I'm Executive General Manager for Education at the college, and it's a huge privilege to introduce the panel that we have this evening to hopefully answer all your questions around the next sitting of the fellowship exam. We have Chris Pike, who is Chair of the Court of Examiners. We have Merrin Pitcher, who is Deputy Chair of the Court of Examiners in Australia. We're also joined by Adrian Anthony, who is the Censor-in-Chief, and by Dr. Charles Jenkinson, who is Chair of RAGSTA, Training Association at the college. I do, though, want to start, of course, to say that RAGSTA acknowledges the traditional owners of country throughout Australia and recognises their continuing connection to land, waters and community. We pay our respects to them and their cultures and to elders both past, present and emerging. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Good evening to you all. Welcome. So we have many of you have already kindly sent in a number of your questions, and we'll start there and work through the questions we already have. But if you are inspired to ask some further questions this evening, the conversation triggers additional questions, then please do add those to the question panel, and I will endeavour to answer as many questions, put as many questions as I can to the panel this evening. So please do that as we go through the questions. I'm going to first, though, turn to you, Adrian. It's obviously been an interesting time for the college and for the fellowship exam, and recently, of course, with the examination being cancelled and then reinstated, and I wondered if I could turn to you just to ask you a little bit about your reflections on that and where we currently stand.
Thank you, Julian, and good evening, everyone, and thank you for joining this webinar. I think it's fair to say that at the time that we made the decision to cancel the exams, we were weighing up all the factors around the logistics and the risks associated with running the exam, and also knowing full well what the consequences are, especially in regard to the candidates, both trainees and SIMGs, and the impact that that was going to have on their immediate future. There's also no doubt that subsequent to the announcement of that cancellation, we received a huge amount of feedback and commentary. A lot of it was very emotional, and I duly acknowledge that that the decision we made as a college was quite disruptive. It was upsetting to many candidates, very, very disruptive, and of course some candidates actually express a lot of distress. So I think that has to be duly acknowledged by myself and the college. We recognise that there was a huge amount of disruption and distress caused by that decision. In addition to that, we received a lot of feedback from the examiners and offering their support to look at all avenues to run the exam, and the college subsequently made a decision to actually reinstate the exams. In doing so, we've had to really look at how we allocate our resources and where we need to put our efforts. It is not possible to run the exam for every candidate, but the principle that we have adopted is to run the exam for as many candidates in as many specialties as is humanly possible, given the barriers and challenges thrown up by the COVID-19 situation across both countries. Specifically, vascular surgery and neurosurgery do not have a sitting for the exam for the rest of this year, so they will be planning to run exams next year. We've had to work with numerous jurisdictions right across both countries both at state and territory levels and national levels, but also going down to local levels, at hospital levels, because we do need to fully appreciate that there are significant challenges with running an exam during the COVID environment. So we are advocating as strongly as we can with government to get enough allowances to allow the exams to run. We are seeking allowances as much as possible. Clearly there are limits to those allowances. We do need to act socially responsibly, and we're not seeking exemptions that would put anyone at risk in terms of their welfare and health, particularly in regard to COVID. So I am pleased to say that we have reinstated the examinations, and obviously that is now widely known. I am certainly very aware of the disruption and significant distress it caused many of you, and not only just for you, but for your families and the support people around you. And there was certainly very strong advocacy from many of your colleagues and from our colleagues, our fellows of the college, to do whatever we can to run the exam this year. So we're running it. It's not to say that events won't overtake us and that we may have to cancel the exams. As we all know, there's nothing that we can guarantee in this day and age, in this type of environment. But certainly as it stands, we are working through all the logistical challenges, and so far, as far as we can tell, we will be able to run the exam. Thanks, Julian.
Thank you, Adrian. Obviously, as part of acknowledging the challenge that has been faced by all candidates during this difficult time, Chris, I might just turn to you and pose a question that we've already had this evening from those listening, and that's around, can trainees be assured that no adverse consequences will result from an unsuccessful result in light of the exam being cancelled and reinstated? Are you able to say a little bit about that aspect?
Okay. Firstly, if I could reiterate what Adrian has just said to you all, and that is, sorry that we have disrupted your preparation for the exam. We're sorry that we had cancelled the exam. We're sorry that we reinstated it what seemed to be at short notice, and we are sorry that you have had so much disruption for what is a major event in your working lives and your professional lives. When it comes to the exam, though, in view of the way that it's been cancelled and reinstated, can you be reassured about no adverse consequences will result from the unsuccessful result? We ask you to reflect on your own preparation and reflect on your own health, and there's fairly black and white regulation and policy around that. You have to be in good physical health, and you have to be you have to judge your own preparation for the exam. Once it comes down to asking the questions and doing the vivas, it will be pretty much we'd expect the standard that would normally be expected of the first year consultant. That's the level that we pitch the exam at, and we'll be looking for correct answers at the higher level thinking that the exam normally runs at.
Thank you, Chris. We're going to drill down into some quite specific questions that people have asked around the different components of the exam. But again, this evening, Maren, one of the audience here, one of the candidates, I'm sure, has asked a question around the relationship between the written and the clinicals. And they've written, with regards to not all candidates being allowed to sit the examinations, I think some of the challenges that Adrian has spoken about that obviously continue to face the logistics of delivering such an exam in COVID. Is there a consideration for candidates who've done the written component and not being allowed to proceed through to the viva if they fail? So a question around, can you separately fail the written exam? Are you able just to address that point?
Yeah, sure. The short answer is no, that can't be done, because the written components are an integral part of the whole exam. So it's a whole exam of all the segments. and the written components need to be considered in light of the other components. They all go together. The exam is blueprinted to make sure that that the curriculum is widely sampled and done, and so there is not a sort of there's not a separation. I mean, there's a time separation between the writtens and the vivas, but they are all part of one exam. So I know that the writtens are not marked prior to a consideration about the vivas. So the marking of that takes place quite close to the timing of the vivas rather than straight away.
Thanks, Maren. And while I've got you, can I ask you another question around the written papers? We've had this question around how is the quality assurance around the written done in terms of people's ability to answer the questions within the time. So what are the processes that are in place to give the college and therefore all candidates confidence that there isn't that the answers are achievable to be written for the written exam in the time allowed?
The thing that I would say to candidates is that the examiners do not expect a perfect answer, neither in the vivas nor in the written. So you're not writing an essay that's 100% correct. You need to be at the level of a first-year consultant, and you need to be able to do that in a clear and coherent manner. So sometimes candidates think they have to be absolutely perfect. You've got to be pretty good, but you don't have to be perfect. So it's not about writing perfect essays. It's about actually answering the question. The examiners between them have decades and decades of experience, and some of them have had a long time asking questions and answering and marking questions. And so it's very clear what they're looking for in that space. They spend many hours devising the questions. The questions are then meticulously taken apart and severely critiqued by their colleagues, along with what is the standard expected within that. So a lot that's done at the examiner workshops and indeed prior to the examiner workshops. And then after the marking of that has been done and the examiners together, there's generally been an agreement on what the appropriate standard will be, and indeed the majority of people do pass the written. So it's not about being perfect in that space, it's about being at the level of a first-year consultant. So I feel very confident that what is required to pass is an acceptable, defensible standard. Some candidates may feel that the questions are hard. Yes, they're hard, but it may not be quite as hard as you think it is to pass them.
Thanks, Maren. And there's always the notes from senior examiners, of course, isn't there, too, to candidates that can be found on the website. So there's some specific details, of course, for each specialty. And a related question, Maren, while I've got you, can candidates get a sample answer to previous questions, say in the last 3 years?
I think you would need to look at each individual specialty's notes on the website. There may be some specialties that do provide that, but I don't think that's generally available.
Thank you, Maren. Again, on the website there is a preparing for the written component, but you're right, it does of course vary between each specialty, and the advice and further advice can be found there on the website. Chris, if I might come to you, Maren started this conversation, but I just wondered if you could provide a little bit more detail about the level of detail required on the written papers and any advice you can provide. We've had a number of questions asking for understanding there are no sort of model answers, but how do people gauge the level, what's required? They're conscious that sometimes the consultants they're working with may not be examiners, haven't been involved in the exam for many years or never have, and where do they seek that advice and support?
Yes, that's a good point, Julian. The most written parts of the exam will have two components to it. One will be a shorter answer or a shorter response, and the other will be a longer response. In orthopedics, the longer response has been taken over by a multi-choice question format, but like in almost all of them, the shorter response, we really are expecting brief answers. There would only be 2 or 3 marking points per question. The examiners will have a guide for the 2 or 3 key points that they're expecting in the response. Even in the longer response ones, the ones that would, for which there might only be 7 or 8 questions in 2 hours, we would be expecting relatively brief responses, so less than 500 words for most of them. And once again, it would be covering the what we'd see as the key points or the principles. And usually it's the questions are pitched at higher order thinking. It's not going to be a list of things. It's really going to be what are the principles of this. And look, the feedback on model answers, I appreciate some training boards run trial exams and they'll have get you to sit down and do the exams in exam conditions and then have a trial examiner mark the questions. If you can possibly get any exposure to that, that's a good way for time management. But otherwise, it's the complexity of the answer, not the length of the answer that we're hoping for. And most examiners will be looking for just a certain number of key marking points per answer. And we all have our own exam strategy around that. There's not a specific answer, but your training boards, the notes from the senior examiners, I'd read them very carefully, and there are some past papers, or at least some sample questions from the college website.
Chris, thank you. And a quick question about the modality of answering. We raised the possibility of delivering the written exams on paper at this next sitting. And we've obviously had some questions clarifying that. Are you able to let us know around where we are in terms of answering the writtens online or on paper? So the online writtens will be continuing as they have always continued. There seems to be no problem with the method by which we're providing that exam. Plastics and general surgery allow for handwritten answers. If you feel like you have a specific need a specific consideration around the time, or special consideration, or even an adjustment for what you perceive as your own disability with your typing skills or dyslexia or some other medical condition, that can be applied for usually around the time of registration, but it's not too late to apply for that leading up to the exam. If things happen to you within 24 hours of the exam, such as an illness or sudden bereavement, then a special consideration can be applied for during the progress of the exam or immediately after it or immediately before it. But otherwise, reasonable adjustment for disability, and some people do have a genuine disability with typing, that the college looked at very sympathetically. But every exam centre, just for what it's worth, because of previous technological failure in some other colleges, every exam centre does carry a paper copy of every exam just in case. Great, thanks, Chris. I'm not sure who said this, I didn't take this up, but there's a question for clarification around 500 words per question, which is to be done in 15 minutes. And did they hear that correctly? I think that may be something you said, Merrin, I'm not sure.
That was me, I think, but yeah.
Sorry, I'll just argue with Chris because I like arguing with Chris. I don't think it's anything about word counts. I think it's basically that my key advice to my candidates is read the question, read the question, read the question and answer the question. Don't answer the question that you want to answer the question that's been asked, because that's one of the major failings. and my tip, so it's not about volume, it's about just getting the key points. And my tip for people who are trying to get a sense of it is speak to the people who've done the exam in the last couple of years, who you know are quite good candidates. They will have done lots of practice exams, and they will give you, they might show you some of the answers that they have done. So pick, if you've got someone who's a year or two ahead of you, who's recently done the exam and has done some practice, that's probably a good, if you can pick the people who you know are pretty smart candidates, that'll give you a good idea of a model answer. Thanks, Maren.
And I won't argue with you, Maren, it's okay.
Good. I don't want to have to break you up. We've had just one final quick question around the clinical exam, the written exam, sorry, before we move to the clinical viva questions. And that's about the English, American or Australian English spelling, which is acceptable. So as the Englishman here, I'll quickly say that any of these forms apparently are acceptable. So don't worry about your spelling as long as it's understandable. So going on to the clinical viva, Chris, can I come back to you and ask you what will be the format of the exam with respect to the number of examiners on site and online, in light obviously with ongoing COVID restrictions?
Yeah, so that will vary from specialty to specialty and site to site. There are some specialties that now have provision for 2 completely online examiners, but for each of those courts there will be someone sitting in the room with the candidate to make sure of the technology and also to observe the process. The vast majority of vivas there will be at least 1 examiner in the room with the candidate, and for all that can manage it there will be 2 examiners in the room with the candidate. There are many circumstances where the college would like to have an observer present as well to make sure the process has been properly followed and that no one has been disadvantaged, getting back to the first question this evening. So there may be extra sets of eyes on the candidates in some specialties. And that's more to do with the process than to do with the actual performance during the viva. But there would be some situations where now there will be 2 examiners completely online, but there will always be someone in the room with the candidate.
Thanks, Chris. And with some of the challenges around using physical patients, are you able to say a little bit about what the differences will be in some specialties in the clinical vivas, so medium and shorts and some of the critical care?
So for 18 months now, I guess, some of the specialties, including orthopedics and general surgery and OH&S, have done away with patients and have used visual aids, including short videos and clinical pictures in the place of having patients for short and long cases. I have to say there's an analysis gone on of those segments, and they seem to be holding up quite well as valid ways to examine what we were planning to examine during those vivas. So that part seems to have gone very well. There are some specialties where watching the candidate address the patient and work through the physical exam seems to be a very important part of their assessments. In particular, plastics would point out that there are many learnings for ways the candidates to demonstrate their skill in addressing a patient and what they can show on a live patient and individualizing patient care that can't be shown just on an actor or some other visual aid, and the same with neurosurgery and the same with vascular surgery. All those 3 specialties seem very keen on what situations can, at least what opportunities there are in directly addressing a patient for the candidate to show their skill.
Thanks, Chris. And quickly back to you, Maren, while we're talking specifically around the exam before we move on to kind of broad COVID related issues. It's a question that comes up a lot. Someone this evening's asked, if you fail both the written exams but pass all the vivas, can you pass overall?
The short answer is yes, if you've done enough, if you've done well enough in the vivas and not too badly in the, if you've only failed by a little in the written. So yes, it's possible. Possible.
The way, Maren would like to add, I'm sure the way the exams are blueprinted, there are some specific things which are covered more than once during the exams, and that's all taken into consideration when it comes to performance in one component or another.
Thank you, Chris. Charles, thank you for your patience, but I do want to come to you now just to talk a little bit about COVID-19 and your reflections on where you see us being in terms of implementing and reinstating the fellowship exam during what continue to be, challenging times for everyone, both professionally and personally, as well as in the context of this exam.
Yeah, thanks, Julian. That's very much a loaded question, and I think that everyone here knows that the COVID time has been really, really tough for us all. Being a Western Australian, currently finishing training in New South Wales and being pre-exam myself, having not seen my family for 4 months because of border closures and all of the difficulties associated with that, I know that it's been tough for everyone, and it's thrown up challenges that most of us thought we would never see in our professional careers. And I know from talking to so many people in the last couple of weeks that the cancellation of the exam was a huge blow for many of us, and I know that a lot of you have told me that having it reinstated has also made the preparation tricky. That's the reason why the Trainees Association had a meeting a couple of weeks ago. I took to council all of the views that came to me regarding the exam and the effects that it was having on the trainees, and I'm very happy to say that council listened to what we had to say, and that's certainly been my experience, that when we've taken our concerns and we've taken them in earnest, and those are the ones that you've all brought to us, that we were listened to. And that's I'd like to say one of the reasons why the exams were reinstated was the advocacy of everyone and the experiences and the stories that you took to us, and I'd like to thank everyone involved in that decision making for that. In terms of where we stand from exams, having gone through the health department guidelines and the requirements, they're very strenuous, they're very onerous, and the advice I gave to the fellowship exam group, the education department and to the council is that this is time for RACs to be agile, to be flexible, to embrace technology and to keep on moving forward. And I think that the way the exam is modelled currently is certainly in keeping with that, and there's been a lot of change that's had to happen very fast, and certainly we're very thankful that that has happened and has given as many people a chance to sit the exam as possible. I think that really the important things moving forward are that we see as much open communication as possible, and there's certainly a willingness from the education department or the exams department at the college, and also from the fellowship exams working group. And I'm told that there will be formal written communication that's coming out within the next week that will go through what the requirements are for the exam, where you'll actually be sitting as individuals, and any required permits or additional documentation that you may need. So that may include COVID testing in some jurisdictions to get around the state health departments and also the current state guidelines and lockdown restrictions. So look, it's been challenging for us all. It's been challenging, for the trainees, for the people sitting the exams, but I'm hopeful that we're going to get through this, and we're going to get through it stronger, and we're going to do it better next time.
Thanks, Charles. And thank you for touching on the requirements around testing. There's a lot of questions coming in around that, understandably. As Charles says, just to reinforce that, we will be writing to you this week to confirm all of that. I have to say it's a moving piece, and obviously a number of jurisdictions do change their requirements, but over time it is at least getting easier to understand the mindset of each state or country in terms of what the requirements are. But they do change all the time. I guess the other massive change we might see, Merrin, is if a state re-enters a hard lockdown, or you're unable suddenly to travel interstate when you thought you could, in the small numbers of candidates who unfortunately need to do that to be able to sit the exam. If you can't move interstate at the last minute, is it possible to sit your exam in your own state?
Unfortunately, that won't be possible just because of the complexities of having the appropriate numbers of examiners and plans. So, in essence, if you're not able to travel to attend that venue, then that candidate will not be able to sit. But there'll obviously be no financial penalty, or that will be refunded. Not that that's much compensation, but in essence, they're outside our control.
Thank you, Merrin. And Chris, just adding to that part of the conversation, what happens if a lockdown situation changes and we are unable to run the exam at short notice in the state that you're in where you were expecting to sit it?
Unfortunately, if there are a number of scenarios there, just say you've done the writtens already, but the vivas are all cancelled in your state, then unfortunately your results don't count for the written in that situation, and you would need to resit the whole exam, the next sitting of the exam, which would be the May next year. Well, obviously, if you can't get to the exam venue safely, then once again, that's a postponed event for you, and you get a full refund. But I think the general rule is that if you can't travel to the exam centre, or the exam can't be run because of either COVID streaming or lack of permits or hotspots, whichever jurisdiction you're coming from, then it's possible for you that even though you may have already sat the writtens, and that exam doesn't count for you, there would be a refund, and you would need to sit on the next available sitting.
Yeah, so it'd be good to get some further clarification on that, Adrian, if that's possible around this. We do often get this question around, I guess it relates to the earlier questions around the relationship between the written and the viva. Are you able to say a little bit more about that, Adrian, in terms of completing the written, and then, for any particular reason? And indeed, there are a number of questions about this. Clearly, of course, if you are in a tier 1 environment, or your hospital as part of your clinical role, you're furloughed, or you are, obviously you get COVID yourself, all of those, of course, will be reasons that you would need to withdraw, and the college, of course, would support you with a full refund, as Merrin says, although that is small compensation, but at least you would know that you would at least get your money back. But what about this challenge around sitting the written but not being able to sit the viva, Adrian? Yeah,
thanks. So I guess there are two groups of situation. The one group is where the exam for the entire specialty does not go ahead beyond the written exam. For whatever reason that might be, that entire rest of the exam, i.e. the clinicals and the vivas, cannot proceed for that entire specialty cohort. In that situation, the writtens have been sat. The rest of that exam can be rescheduled at a later date, and therefore the written exam can be carried over because, as I said, as Merrin has said, it is blueprinted for that one exam. The situation which I think many of you are referring to is what happens in your own individual circumstance where you sit the exam, but then for whatever reason you are not able to proceed to the clinicals and the vivas. And that may be affecting you, it may affect some of your colleagues, some other candidates, but it doesn't affect the entire specialty cohort. in that situation, the exam is still being run, the vivas and the clinicals are still being run for the rest of the specialty, and therefore in that situation, for that individual candidate who cannot proceed, their exam is actually cancelled. So they will then have to resit the entire exam. I think the concept of blueprinting is an important one to just understand. What it means is that every component of the exam is mapped against the curriculum for that specialty. And so there's a balance of the curriculum being covered. It does mean that there are some parts of the writtens that examine certain aspects of the curriculum which may not be necessarily examined by other parts of the curriculum, other parts of the exam. On the other hand, there may be some overlap in how the parts of the curriculum are examined across the writtens, the clinicals and the vivas, to the extent that if, for example, in one specialty, if one particular aspect of the exam is covered by the writtens and is also covered by the vivas, and a candidate does well in one but not in the other, if they've done well enough in one part of the exam and that aspect of the curriculum is covered by the part that they, let's say they didn't do so well in the writtens, but they've already demonstrated in a subsequent part of the exam that they've done adequately well for that particular area, that's a situation where it may be possible for that candidate to pass the exam because they've demonstrated that they've actually understood that aspect of the curriculum. So the concept of blueprinting is really important to understand. And certainly the Court of Examiners have discussed this particular issue, and in the format that the exam is currently, it would not be feasible or appropriate to actually split the written totally from the clinicals and the vivas and have them carry over into a new exam. I did see a question about, well, what about splitting the writtens completely and have the writtens, I guess, implying that the writtens become a hurdle, and then only if you pass the writtens can you then proceed to set the clinicals and the vivas. Well, that's certainly not the situation that we're currently in. It would require a change to the exam format and a rethink about whether that's appropriate or not. And certainly some colleges do that, but then there are other colleges that don't do that. But that is really not a question that, if we answered that now, would actually have any impact on what's going to happen over the next few months for all the candidates. So just to reiterate, if you sit the written and for whatever reason you cannot sit the clinicals and the vivas, but the clinicals and vivas are still being held for other candidates, then that exam is cancelled for you and you cannot carry that written paper over. I hope that clarifies it to some extent, Julian.
Thank you, Adrian. It does. And there's another related area that's important here, I guess, in terms of the sort of consequences of not being able to do the viva after the written, or not being able to do the exam on this sitting. And Charles, that of course all relates to you know, the challenges of continuing in training or continuing post-training. I just wondered if you had any reflections or could provide any reassurance around the impact on people's pathways in terms of training or post-fellowship or consultant roles.
Yeah, so that's an area where at the very beginning we were very strongly supportive of the way that it was handled at the very start of the pandemic. Basically, we want to see that COVID has the minimal impact possible, that the uncertainty surrounding these issues has the minimal impact possible. And the one assurance that we discussed not long ago with the Education Department and also with the Fellowship Exam Group was that the college would be happy to write letters of support for people who couldn't sit their exams for various reasons. For instance, if an exam wasn't able to be held, or for instance, you know, if you got COVID, or you had to at the last minute withdraw because of an outbreak or one of these issues, that the college would write letters of support going through to mean that if you were to be undertaking a fellowship, for instance, that the lack of your fellowship exam or the lack of a FRAX would be unlikely to hold you back, because the college would basically say, well, look, your exam pending, but you would otherwise, probably have your exam and be going on for your fellowship or indeed a junior consultant role. And RACS did do this for a number of trainees on the first time around through COVID when the exams were cancelled, to try and provide a bit of a buffer to how this would actually impact people's career progressions. And when I asked for this in a meeting a couple of weeks ago, that was a very quick and easy yes, that's possible for the college to do. So that was very pleasing for us as your representatives, that at least there is a little bit of a buffer and limiting the amount that this will slow down any future career progressions. Now, in terms of quarantine, one of the questions we did have asked was, if you do have to quarantine prior to sitting your exam, or indeed afterwards, or perhaps in both directions, would that period of quarantine count towards the maximum of 6 weeks leave in the term limit? That's a very common question. In the past, the specialty training boards have viewed these on a case-by-case basis, but have been very lenient in the sense of, if it's a government-mandated quarantine, they're often very, very lenient towards it in saying that does actually form part of your training periods outside of the 6 weeks. So what I would suggest that people do is, if a quarantine period takes them over the 6 weeks, send an email to your specialty training board and more or less just notify them that it was because of a government requirement for quarantine. And in the vast majority of cases, I would imagine that will more or less satisfy things. If it doesn't, your next port of call would be either through your specialty training reps, and you should know who those are, or through RACSTA, and we'll advocate on your behalf. And as I say, it's we've not really seen it be a problem when it's been raised in the past.
Thank you, Charles. That's really helpful. And probably just to add that if anyone this evening joining us is an SIMG, all of those statements are again supported. Please just contact the SIMG department at the college, and all the same things that Charles has very nicely summarised there are all relevant for you as well, in terms of your ongoing supervision, etc. Chris, can I come to you with the next question, which is around when will the results of the exam be released?
Thanks, Julian. If I could just kick off by saying just how visible and how incredibly active RACSTA are in the process, and how well Charles has represented his group. It really has been a great benefit to the whole of the examinations department to have RACSTA so absolutely involved in the process, and I do thank you as a group, and I thank you personally, Charles. I don't want to embarrass you in the middle of the webinar, but now
I sometimes ask very difficult questions.
Yeah, so the giving of results. So previously the results were made available 24 hours after the last Viva. I'd have to say we've, because of the number of centres involved in the exams, how often, now when I say often, during the last sittings of the fellowship, we've been spread across up to 5 time zones. It does make it very difficult to collate all the results in such a timely fashion. So the final recommendations of the full court of the Court of Examiners doesn't come now until later in the week after the final Viva. So normally speaking, that has been within a week of the final Viva, but certainly not in the first part of the week. It's been in the later part of the week. But the next part is the provision of the results to the candidates. That depends purely on whether people are isolated or in quarantine in a hotel, whether they're given the next day or whether they're given some time later. So we have, for better or for worse, taken a welfare or pastoral care kind of approach, in that we would strongly prefer not to give results until people are surrounded by their support systems when we give the results, in case it's bad news. So the last exam we had said it was 2 weeks after the last viva, given that they would be 2 weeks in quarantine. So there can be a bit of a intelligence gathering straight after the exams about which candidates are might that affect, and then there was a whole discussion around whether it's a blanket rule for everyone or whether some specialties could go bit by bit. I'd have to say during the last 18 months it has been an approach of one in, all in, and there is some strength in solidarity, and it doesn't lead to any kind of mixed messages or people thinking their own particular case might be different to the stated rules. So just at the moment they're the rules. So the results are ratified within a week of the last viva, and then the results will go out to candidates as soon as the last one is out of quarantine or with their support systems.
There is a request already this evening, Chris, but I think you've covered it, which is around could the results for candidates who are not in quarantine go straight out? But it has been a topic of conversation for some time. It certainly would be very helpful if you are one of those candidates and you find yourself in quarantine to contact the college so that we can definitely make sure whatever the overarching decision is that you are, your situation is handled in a way that's most helpful to you, because clearly those in quarantine also have different views about knowing and not knowing. The challenge is once you know, you can't unknow. That's the difficulty, isn't it? Charles, can I come back to you again about some of the logistics? And we've had questions around the registering process, and somebody's asked, I was asked to re-register for the exam but have not yet had confirmation that I have a place, and they really want to find out what's going on and what's happening. Are you able to provide some advice around that?
Yeah, look, sure. So everyone who has registered and paid, I believe, has a spot in the upcoming fellowship exam from when we've asked that question. And as we mentioned before, this week, and I'm told it will be in this week, not in the next week, so it will be soon, you'll get an email with all of the details regarding venues and what to expect for the writtens, as well as more details surrounding COVID requirements. So in case you do need supporting documents or in case you do need COVID testing. So if you've registered and paid, then as it currently stands, that you have a spot in the exam.
Charles, thanks very much. Chris, if I might come back to you, someone's raised the idea of giving an interim fellowship, so that if you're unable to sit the exam in time, you could move into a PFET or a consultant job. Have you got any reflections on that idea, that you could move on and presumably take your fellowship exam, for example, within the following 18 months or something like that?
Yeah, look, it's has been raised previously as well, and the idea does have some merits, and even on College Council there would be some proponents of that. But to be fair, one of the reasons to try to ensure there was an exam opportunity this year was to make it easier for the allocation of people with their fellowships into fellow jobs, should they need them, or PFETs next year. There's an inherent weakness in a provisional fellowship. There are some stipulations in some jurisdictions that only someone with a FRACS can open an operating theatre after hours. Only someone with the post-nominals can do other more kind of complicated tasks around the hospital administration-wise as well. So partly an interim fax hasn't really been explored as to whether it would fulfil all those entitlements of having the post-nominals. The other thing is that we have pretty well determined that almost every PFET, certainly within our two countries, will not put a barrier of not having the FRACS in letting you advance into the fellowship position, given that if the only reason for not sitting was the COVID misadventure, so to speak. So I think given examinations and the training board's fairly close working relationship during this COVID time, people have been able to move fairly well into fellowship positions, at least in our two countries, without the post-nominals. So we haven't felt inclined to give the interim fellowship. But appreciate some other countries have done that, and other people have looked at it as well. Just at the moment, we think we'll stick with our plan. So.
Great, thank you, Chris. I just want to mop up one question. It's rather specific, but I think it might be worth addressing, Adrian, because it does come up quite a bit. And this was that in a previous session we've talked around the idea of if you were to take the written but unable to take the viva, you potentially would be allowed to make a decision about if you carried over the written or not, or if you advanced to the viva having taken the written. I wondered if you could just address that, because I know that has come up a few times.
Sure. Actually, before I do that, I just wanted to say also with the interim fellowship that there's no legal standing with the Medical Board of Australia or, in fact, Medical Council of New Zealand. So there would be issues there about recognition of what an interim fellow would actually mean. So that last time, that really applied to a different situation where it was felt that the exams would run, the exams would be cancelled even though the writtens had been sat. And at that stage, the examiners felt that if they then ran the exam later on and they had a new exam, they thought that to minimise the disadvantage to people, then they could possibly consider having that written taken over. But really, after discussing it further, they felt that that really wasn't an appropriate thing to be doing, and that it would be much more educationally sound and from an assessment point of view sounder to actually have the written and the vivas taken as one sitting, one exam, and hence the clear decision subsequently that the written component could not be carried over, and that's unlikely to change given the deliberations of the Court of Examiners about the exam being a single exam with different components. And as Maren said, the fact that there's some time lapse between the different components does not mean that that the written is actually a separate part of the exam. It's still part of the same exam.
Thank you, Adrian. Thank you for clarifying that and putting that issue to bed. It does come up a bit. I'm conscious we're coming up to the hour, and I just would want to take the opportunity to come to each of you in turn just to see if you have any sort of final reflections, closing remarks. Chris, can I, as chair of the court, it's certainly been a very challenging time. You've led the court through, a very challenging 18 months or so. What are have you had some reflections and some thoughts you wanted to share with candidates this evening, just to close?
Thanks, Julian, and your own contribution hasn't gone unnoticed either. So, look, the court are very conscious that everyone is working hard, not just the court, the rest of the college. We see candidates studying very hard. If I could reiterate the apology, we are sorry that we have disrupted your preparation so much by the cancellation and the reinstatement. So we have listened to what you had to say to us. You'll be happy to know, and I think Adrian will probably touch on this, that we've been directed by council to provide more contingencies around the surety of the exam. So we'd like to acknowledge that as well. I think you'll find when you get to the exam that the examiners are really quite sympathetic to you. Despite what I said earlier, that there is a standard, but I think examiners are keen to see well-prepared people do well, and I think you'll find that they'll be really quite helpful, quite friendly. It's a very fair process. I would just encourage you to keep preparing, keep doing trial exams if you can, and look forward to the big event coming up in November, well, October and November.
Thanks, Chris. Merrin, as one of the deputy chairs, any additional thoughts?
Look, I think it's been a very complicated time for everybody. I think COVID has really disrupted everyone's plans in all aspects of life, and as you know, Charles hasn't seen his family for 4 months. I mean, it's just appalling, really. But I think that what the college and the exams department has aimed to do is to provide an exam. We want to run an exam. We want to get people through. You've put a lot of time and effort into getting to this point. We want you to be able to demonstrate that you can do that, and it's not in the way that we've done it historically, but we've made a way that is achievable because we have done it before, but it's not without, you know, huge sacrifices on your part, but an awful lot of work in the exams department. So I agree with Chris. Most examiners, you think they're pretty scary, but actually they're human beings and just like most of your colleagues, and we encourage them to treat you as colleagues in the exam. We want you to turn up, do your best and show us what you know.
Thanks, Merrin. Adrian?
Thank you. Yes, look, I'd echo Chris's comments about the decision was a very regrettable outcome in terms of the disruption and the distress it caused people. I can reassure every candidate and all of the college that the college is actually putting an extraordinary amount of resources, both in personnel and in time, to ensure that these exams run as safely and in a feasible way, but also to the expected standard. They are the three key areas that we are wanting to make sure that we meet those requirements. It has to be safe for everyone. It has to be feasible. It has to be to the standard. So be reassured that with the exams progressing, and let's hope that there's nothing that derails the exam for anyone, that you should be confident that you'll have those three key areas met. In terms of moving to the future, as people have alluded to, we are looking how we can adapt the exam in an environment where COVID will continue to exist. Let's hope that restrictions improve in the not too foreseeable future, not too distant future, but nonetheless, as a college, you'd expect us to be having effective contingencies. So certainly we will continue to work as a college towards that. My best wishes to all of you in your forthcoming writtens and in the clinicals and vivas subsequently.
Thanks, Adrian. And Charles, I'm keen to leave the last few words to you.
Yeah, thank you so much, Julian. Look, I think it's just important to say that your voice matters. Talk to your specialty training reps, talk to RACSTA. We, unlike in years gone by, are a valuable voice at the table and we are heard. And what we need as your representatives, you know, both myself and the other members of the RACSTA committee, is to hear your views, and we certainly do take them. And we are listened to, and I'd like to thank, you know, Chris and Adrian and everyone else, and Merrin and Julian and everyone for, you know, having us at the table, because these are the reasons why we can actually work with the college to make sure that things are better than they were before. And I do think that that's happening, but that can't happen without your voice. So for all of the SET trainees, you are all RACSTA members. Your voice does matter to us, and we actually need to hear you. So please get in touch with those people. And you know, all the best for the upcoming exams. I really do hope that they go ahead without hitches and without any hang-ups from COVID. But, you know, give it your best, and hope to see you on the other side of it all.
Thanks, Charles. Thanks for those final words, and I will make them final other than just to say thank you to each of the panel. Thank you to all of you who've joined us this evening on this webinar, and just to add my best wishes to you all as you sit the exam over the next few weeks. Thank you and good night.